Good morning. This is Dr. Deepali Kashyap from Galleria Women's Health, and today I'm going to talk about very basics of female reproductive anatomy and some very basic terms which you hear all the time. So I thought I'll just clarify some of the words that you normally hear. So let's start with uterus. We have all heard about uterus. So uterus looks like this. It almost looks like a pear where it is broad at the top and kind of narrows like a funnel at the bottom. Now, if I've sliced it open, and that's how it looks from inside. So it has three layers. The innermost layer is called endometrium. The bulk of the uterus is made of a muscle, it's called myometrium, and the outside is called serosa. Now, what do these terms mean? So the endometrium is basically the cells which in our menstrual cycles, the cells keep getting built up here, and at the end of the cycle it comes out as a blood or as a period. So that is why it is very important to have regular periods, because otherwise these cells can keep getting accumulated and thicker, and those cells are more prone to becoming abnormal and even cancer. So if you're not on any progesterone or any other hormonal kind of medication, it is very important to have at least one period in a quarter. Now, the next we come to the bulk of the uterus, which is the muscle or the myometrium. So this muscle is the one which really strongly supports the uterus. I mean, if you think about it, when we get pregnant, then this is the part, the innermost part where the pregnancy or the fetus develops. So there are a lot of things, the fetus, the fluid, the placenta, and everything really needs to be well protected. So that's why we have the security guard which is buffed up and all muscled up, so to be able to protect that. Now the outside, the serosa, is basically just covering, it's almost like a bag to hold everything inside. The bottommost part of the uterus is called the cervix, and we'll get to that. Now when you hear about the term fibroids, what are fibroids? Fibroids are basically overgrowth of the muscle. They are generally not cancerous, and briefly talking about, they can be as small as the size of this pea. So a lot of women have it and they don't even know, but they can be as big as this cantaloupe right here. I've actually, a couple months ago, I removed a fibroid which was 3 times the size of this. So as you can imagine, if somebody is walking around or living their life with this, it will cause a lot of pressure, discomfort, and depending on where it is putting the pressure, you'll get symptoms like back pain, or if it is sitting on the bladder, one might have constant urge to pee all the time. Sometimes, depending on where they are, they can actually also cause blockage of urine to come out and urinary retention. I hear this word like a lot of time that I have cyst in my uterus. It's generally not true. It's basically the fibroid, which is not a cyst, which is a muscular growth. Now, the second important organ I come out to, ovary. So the ovaries look pretty much like this. They're about 3 to 5 centimeter. When we are menopausal, they really become really small in size and almost look like raisins. So see how it is very difficult to even see, but that's pretty much how the ovaries is. Now the concept of cyst actually is in the ovaries. The ovaries make cells every month. Most of them, one of them actually releases an egg, and most of the other ones kind of die off or become smaller. Sometimes if they don't become smaller and if they persist, then that's called a cyst. It's water-filled cyst. Again, the cyst can be as small as the size of the pea, not cause any problems. You don't have to be worried. Or sometimes they can again become very big. And yes, the ovaries, some of the cysts can become cancerous. So the next organ is fallopian tube. So they look like straws, and they are hollow but much more flexible. They arise from the top of the uterus. I'm going to put them here. And the main function of the end of the fallopian tubes has like a claw-like things which are called the fimbriae, and our ovaries kind of sit at the end of those fimbriae. So the main function of these fallopian tubes is basically just to grab the released egg and take it there, because this is where the fertilization happens. So we do need functioning fallopian tubes to be able to get pregnant. All right. Now, another important concept which I really wanted to talk about was endometriosis. So you've heard the term endometriosis. So what that is, the cells which I talked about earlier, endometrial cells. So if these cells are present outside of the uterus, that condition is called endometriosis. It could be present on the fallopian tubes, on the ovaries, inside the abdomen, closer to the liver, on the bladder, rectum. They can be present anywhere. So now if you imagine, like when you have your menstrual cycle, these cells can also bleed, can create more inflammation, scar tissue. That's why women who have endometriosis can have a lot of pain with your periods or with intercourse or with bowel movements or when they urinate, depending on where those are. There's also another term called adenomyosis. What that means is, again, these cells of endometrium are now present in between these muscles. So when that happens, our muscles are not able to contract properly because there is some blood in it, and that's one of the causes of abnormal bleeding and enlarged uterus. Very important concept, and the last concept is a pap smear. So the bottom of the uterus, like I said, it's called the cervix. It's almost like, if you imagine, like door to a room. That's why when somebody is pregnant, it is very important to have a really a normal cervix which can hold everything together and not open up. Okay, so when you go for your well check or gynecological exam, so this is something try to create. Imagine if this is the vagina, and when we do an exam, this is where your gynecologist is actually looking at the cervix. The cervix is here, this part, and this is where we take the pap smear from, the cells which are released all the time. The reason it is important is because this is the part of the body where there's very, very rapid turnover of the cells and which is prone to cancer, and that's what we take it. So this was, in very briefly, some of the words that you commonly hear about female diseases or female reproductive tract. If you have any questions, if you want me to elaborate, you can leave it in the comments, and I would be very happy to provide more information. And I really hope that you find it useful. Thank you and have a good day.